Thank you, Jordan. Thank you. Gee, after all that, I'm glad I'm taking my adrenal cortex. Everything you wanted to know about mental health, nutrition, and have the guts to ask. I'm going to deliver a big buffet to you today, and just feel free to take in what you can and digest what's meaningful to you right now. The PowerPoint will be available later on. I want to begin with the concept of diagnosis. I want you to begin to think about what we call things, and I'm going to take you on just a little bit of history of the last 1,000 years. The ancient Greeks thought that hysteria came out of a woman's womb having become dislodged and traveling up into her throat, thus paralyzing her. That was our early concept of what we now call PTSD. Fast forward to Freud and PTSD in the early 1900s. Men who came back from World War II with symptoms of PTSD were called sissies and sent right back to the front. Let's fast forward to the lobotomies of 1950 for the treatment of psychosis, and we all know what no good that led to. And then you remember the refrigerator mother in the 1960s was blamed for her autistic child. Now, we are no different today. We have an epidemic of psychotropic drug use that often is misapplied. Much of it doesn't work. So as we go through our work as clinicians, as we even discuss what we're going to in the next hour, I want you to keep in mind that we are influenced by our time and our culture, and we should always question diagnostic categories, because in many ways we're no different from the ancient Greeks. We just know now that the uterus isn't the cause of hysteria. As you're developing your plan to help people alter their consciousness naturally, stabilize their food, I want you to consider the principle of substitutions. Ask, what is the behavior trying to self-medicate? Those of you here who work in addictions know this well. I'm going to take a substance to alter my consciousness based really on what my mood, my affect, and my brain craves. So find the healthy substitution for what that craving is. I want to teach conscious self-medication with foods. I do not believe in the just say no idea to drug use. It doesn't work with children. Teach them about consciously and healthfully altering their consciousness. If we look around the world at indigenous populations, we have drumming, we have dancing, we have fasting, we have the use of mushrooms. We've got the use of all kinds. Indeed, some people suggest that Eve was not eating an apple, she was really eating a mushroom. And that's what gave rise to religion. So I don't believe in my clinical practice that we're successful always. Some people benefit from complete sobriety. But really what we want to do is we move people and help them move towards sobriety or towards cleaner living, healthier living. We start teaching them about why they're doing what they're doing, finding healthier substitutes. And you know this when you get someone off of nicotine, for example. You target the nicotinic receptors in the brain. We use lobelia, for example, to do that. So think in terms of these substitutions when you're working with people who are very mood labile and who are having a hard time really balancing and self-regulating their mood. And here's a picture of the Buddha, the Bodhisattva, eating figs rich in tryptophan. Now, some people suggest he saw the light because he was stuffing himself with figs. And his serotonin went way off the charts, and he gained nirvana that way. So I've given you a nirvana recipe here. Arugula peach salad with plenty of figs. Figs are rich in tryptophan, and they'll elevate mood.